There have been 4 measles outbreaks this year. In this country last year, there were 16. So it's not unusual. We have measles outbreaks every year.
As he was saying this last week, it was the worst outbreak in 30 years in Texas and has now spread to 10 states. It's actually so bad that Mexico has issued a travel alert to its citizens not to travel to Texas.
Hey, it's Jordan. I am in Flint, Michigan, East Palestine, Ohio, Tumwa, Iowa. Please support the only independent outlet on the ground covering what the corporate media covers up.
Hey, it's Jordan with Status Coup. RFK Jr., the Secretary of Health and Human Services, has called for people to get vaccinated against measles. Kind of. Well, sort of. As we have a mass outbreak, the worst in Texas in 30 years, and now an outbreak into 10 states. At the same time, he has removed the ability for the public to issue comment when the health department sets forward new health guidelines and rules. Let's first give you an update on the measles outbreak before we get to RFK Jr.'s endorsement of getting vaccinated. The outbreak has now spread to as many as 10 states, 160 cases that we know of. Let's take a listen here.
Tonight, there are now more than 160 measles cases in 10 states, with Kentucky and Washington reporting their first patients. But Texas has seen by far the most infections, 146 statewide, and the death of a 6-year-old child. San Antonio officials warning hundreds, if not thousands of people may have been exposed by a recent infected visitor.
I want to take this podium to send a plea out and urge the community. We say this in every phone call we get. If you are sick, please stay home. Don't go to the movie theater. Don't go to, large restaurants.
How infectious is measles?
Measles is the most infectious virus that we know of right now.
Dr. Ronald Cook oversees public health in Lubbock, Texas, a city where 20-plus children are currently hospitalized.
That's a significant number. We consider children and young adolescents, young teenagers to be our healthy patient population.
One mom in Lubbock who grew up in a developing country telling us why she's rushing to get her daughter vaccinated.
I got measles as a kid because there was no vaccine. But here in America, basically it's free and accessible, and yet people choose to, ignore it.
The CDC just issuing its first advisory since the outbreaks began in early February, including this reminder: vaccinations remain the best defense against measles infection. Dr. Caitlin Baston is New Jersey's health commissioner, another state that's seen an outbreak.
It's critical to me that families can trust the information they're getting from health professionals. So I will tell you, again, vaccines are safe and effective. This is not up for debate.
Vaccines are safe and effective. This is not up for debate. Well, just last week, as this outbreak was spreading, again, in Texas in particular, this is the largest outbreak in nearly 30 years. Nearly 30 years. Let's listen to what RFK Jr., who's got a lot of fans, including maybe some viewing now, RFK Jr. wasn't really that worried last week. Let's look at him downplaying the outbreak just last week in the cabinet meeting that was taken over by Elon Musk.
We're watching it, and there are about 20 people hospitalized, mainly for quarantine. We're watching it. We put out a post on it yesterday, and we're going to continue to follow it. Incidentally, there have been 4 measles outbreaks this year. In this country last year, there were 16. So it's not unusual. We have measles outbreaks every year.
As he was saying this last week, it was the worst outbreak in 30 years in Texas and has now spread to 10 states. Let me repeat, 10 states. It's actually so bad that Mexico has issued a travel alert to its citizens not to travel to Texas, as well as 7 other states. Well, suddenly, a week later, RFK Jr. is singing a different tune, I guess, sort of, kind of. There's been a lot of headlines that he came out calling for folks to get vaccinated for measles based on this Fox News piece by RFK Jr. that was released yesterday. But if you actually read it, not so much. Not really. Headline: Robert F. Kennedy Jr., measles outbreak is call to action for all of us. MMR vaccine is crucial to avoiding potentially deadly disease. I'm not going to read the whole thing, but I want you to stick with me because it's very important. And I used to write for news websites, including Fox, a couple other places, so I could tell you. First paragraph, as the Secretary of the U.S. Department of Health and Human Services, I am deeply concerned about the recent measles outbreak. The situation has escalated rapidly, with the Texas Department of State Health Services reporting 146 confirmed cases since late January 2025, primarily in the South Plains regions. Tragically, this outbreak has claimed the life of a school-aged child, the first measles-related fatality in the United States in over a decade. Now, if you look at this part right here, if you read a lot of news on websites, you'll notice that a lot of times a news editor will pluck what they think is a catchy or important part of the piece and put it, in this block quote, they call it. So take it out of the actual story and kind of put it prominently somewhere. So Fox News's editors put this part prominently right here under the first paragraph. Vaccines not only protect individual children from measles, but also contribute to community immunity, protecting those who are unable to be vaccinated due to medical reasons. So you might say, wow, RFK Jr., that's the clearest he's been on endorsing a vaccine. And he did it right here, right at the beginning of the story in the second paragraph. Only he didn't. If you actually look at the story, here's the headline. One paragraph, 2 paragraphs, 3 paragraphs, 4 paragraphs, 5 paragraphs, 6 paragraphs. Here we go. The 7th paragraph, RFK Jr. Parents play a pivotal role in safeguarding their children's health. All parents should consult with their healthcare providers to understand their options to get the MMR vaccine. The decision to vaccinate is a personal one. Vaccines not only protect individual children from measles, but also contribute to community immunity, protecting those who are unable to be vaccinated due to medical reasons. Do you see what Fox News did here? Literally, he couldn't bring himself until the 7th paragraph of his own piece, kind of sort of endorsing the measles vaccine. He had to bury it 7 paragraphs in, and he didn't even really strongly call to get vaccinated. He just told parents, hey, consult your healthcare providers to understand your options. The decision to vaccinate is a personal one, but vaccines do protect individual children from measles. Well, why should they consult their health providers when you are the top health official in the country? What you say matters. What you say, parents might listen to, but you didn't actually strongly endorse them to get vaccinated. You just said it's a personal decision. Vaccines not only protect individual children from measles, but also contribute to community immunity, to the point where Fox News literally had to take your mealy mouth, weak sauce, quote, endorsement of getting vaccinated and pluck it out of the 7th paragraph and put it here right under the first paragraph. Now you might say, Jordan, aren't you being a little unfair here? At least he's calling for it. Well, is he? I don't think he's actually strongly calling for it. And by the way, a lot of experts and doctors pointed this out on social media yesterday. He's just giving facts about it, but telling you to reach out to your healthcare provider and saying it's a personal decision, but it is available. Well, at the end of the day, parents are looking for guidance. What is the best thing for my child? Yes, duh, it is the parent's choice, but they're looking for someone with expertise, which, by the way, he doesn't have, to tell them, is this safe for my child? Will this prevent possible hospitalization? You could get pneumonia if you're an unvaccinated child with measles. As you could see, you could die, as one child has already died. There could be permanent damage done to children, even if you live. And he's not really strongly endorsing it here, which is why Fox literally, and again, I've worked for websites, news websites. I know how it works. Fox literally had to move his quasi-endorsement of getting the measles vaccination from 7 paragraphs down to under the first paragraph. And frankly, the sub-headline here, this is the headline, this is the sub-headline, I'm not even sure it's written by RFK Jr., because a lot of times the headlines are written by the actual news outlet and the sub-headline are written by the actual news outlet. I can tell you, before Status Coup, I wrote for a bunch of news websites, and my headlines were often changed and sub-headlines often changed. So I guess you could kind of give him some brownie points for kind of sort of endorsing it, but it doesn't go far enough by a mile. And by the way, at the same time, he's kind of sort of endorsing getting the measles vaccine for kids. The Trump administration, i.e. RFK Jr., head of Health and Human Services, cancels meeting on flu shots. The Trump administration has canceled a meeting on scientific experts called to discuss next winter's flu shots, and a move that underscores fears of emerging anti-vaccine policies under the new health secretary. The FDA, which Kennedy oversees, notified members of its vaccine and related biological products advisory committee on Thursday that the next meeting scheduled for March 13th was canceled without providing an explanation. Anyone that knows anything, time is of the essence. With the flu shot, you're trying to get ahead of what experts predict will be next year's strand. And this year, they were off as far as the strand. And we had the worst flu outbreak in, I think, 15 years. So delay in meeting and putting a formula together for anticipation of next year's flu vaccine could very much weaken the effectiveness of the flu vaccine. Why are they delaying the meeting? No clue. Nobody's revealed it. Oh, and by the way, this is another thing that is not getting a lot of attention, which how could it when we have a flood the zone strategy by the Trump administration and there's a new disaster, corrupt occurrence flooding the zone every other day, every other hour. RFK Jr. moves to eliminate public comment on human health services decisions. Health and Human Services decisions. In notice to Federal Registrar, health agency says public participation is not needed in many decisions. Health and Human Services Secretary Robert F. Kennedy Jr. posted a document Friday proposing to strip public participation from much of the business his department conducts. The move comes during a time of major upheaval across federal health agencies, and as the public waits to see how Kennedy will enact his pledge of, quote, radical transparency. Yeah, how's that for radical transparency? Let's cut the ability for the public to comment when Health and Human Services issues new rules and guidance. The statement placed in the Federal Register said Health and Human Services would rescind its longtime practice of giving members of the public a chance to comment on the agency's plans. It is set to be formally published in the Register Monday, March 3rd. Quote, this is a direct attack on the idea that Health and Human Services, a gigantic agency, should have to tell the public everything that it's doing, said Alex Howard, an open government advocate and former director of the Digital Democracy Project at Demand Progress Educational Fund. Normally, before issuing a new rule or regulation, the public is given an opportunity to submit written comments in support or in opposition to government proposals. This has been the case for years under the Administrative Procedure Act. However, Kennedy and Health and Human Services are arguing they don't need to seek public input when the agency is making decisions about, quote, agency management or personnel, or related to public property, loans and grants, benefits, or contracts. HHS can also choose to cut out public participation when it deems the process, quote, impracticable, unnecessary, or contrary to the public interest. So when RFK Jr. decides that alerting the public what they're doing or new rules or guidelines they're issuing, if he decides it's impractical or unnecessary, they're not going to tell you. How's that for, quote, what did he say? Radical transparency? I know there's a lot, RFK is very polarizing and there's a lot of fans and stans. And if you're watching and you're such a snowflake that even meekly criticizing him is going to trigger you and make you unsubscribe, goodbye. I'm done with this internet culture. If you don't feed me what I want to hear 200% of the time, I'm out. If you don't tell me what I already agree with 100% of the time, unsubscribe. Goodbye. This is not a safe space to feed you what you want to hear 24/7. But I have a source who works at Health and Human Services. Obviously, I'm not going to reveal who that source is, but I talked to that source this morning about this new rule, particularly removing public comment. The source said what people are missing is that without going through the public comment process, new rule implementation will happen much more quickly. The public comment process always adds something like 6 months at least. The purpose of this move is to make rapid changes without public oversight. This change also applies to Medicare and Medicaid policy. So I asked the source, it seems to me to be a backdoor way of stopping public comment process for posting rules and guidance on potentially vaccines, disease outbreaks. The source responded, that was one of my thoughts as well, considering RFK Jr.'s position on vaccines. My read, though, is that it applies to all sub-agencies. This is going to impact services like Obamacare, Medicare, and Medicaid. I've done a lot of work regarding rulemaking for the Affordable Care Act. I think this is going to make it easier for states to remove themselves from the Obamacare exchanges, similar to what Georgia has done. Another problem is that back under Trump first term and Biden's early in Biden's term, there was an insurance company that tried to get onto the Obamacare exchange. It was a fixed indemnity issuer pretending to be a traditional health insurance company. They provided no out-of-pocket protections to consumers as required by Obamacare. By hiding rulemaking from the public, you're going to see scam plans like these more easily make their way onto the federal Obamacare exchange. Just another way to chip at Obamacare, not to mention hiding any changes to Medicare, Medicaid. Seems at odds with radical transparency. I, for one, am not okay with RFK Jr. deciding which rules or guidelines from a longtime anti-vaxxer the public is alerted to. Let me know what you think in the comments. Please continue to support Status Coup's independent reporting for as low as $5 a month.